So Dr. Martin, it's all you now.
Thank you so much. Hello, everyone from New Delhi. I always look forward to my annual visits. I get so excited every time I start planning to come to Napa to meet with Rita, you, and to meet with your parents, Casey and Gisla, and all the wonderful supporters there. And then I get ready to head off to Sacramento, where there's Nalini and Manmohan and all the wonderful supporters in Sacramento. And I've been typically having a student come with me. And I wish I could have been with you in person. I really do. And I miss you all a lot. But I'm so glad that we've been able to meet together like this on Zoom today. And thank you so much, Mohan. Thank you so much, Peter and Nalini and Rita, for having pulled together this amazing opportunity, even during the hardest of times. And I know that we couldn't hear what Mike had to say, but I'm sure we'll find a way of hearing what he had to say later. But do give him a very big thank you from me, as well as from the entire ASHA family, for having taken the time out to record the video. Of course, we always look forward to seeing him year on year. He's been coming for the past 22 years. So a big thanks to Mike and Jan, that if you can please convey that from the entire ASHA family, that would be wonderful. So on the 24th of March, all of a sudden at 8 p.m., the Prime Minister of India, Mr. Modi, announced on national television that from midnight, there was going to be a lockdown, which is going to be nationwide. And when that announcement happened, the people living in the slums, there are 4 million of them living in Delhi, they were absolutely shocked. They had never heard of this word lockdown. And of course, they had no idea what Corona was all about. All they knew is that the Prime Minister saying you can't go to work. And so they were shocked. They just didn't know how to react. They didn't know how to respond. They woke up the next morning thinking maybe there's a mistake. So they went out and they started trying to get to work. And before we knew, within the next few ensuing hours and days, the police was out on the streets, and the police was brutally beating them and sending them back to the slum colonies that they belonged to. They beat them on the back, they beat them on the legs, and they were really so aggressive and violent with them, and they didn't know what hit them. So they went back home, and all of them are daily wage laborers. They work in scrap yards, beating metal, or they strip wires, separating the metal from the copper, or they pull cycle rickshaws, or they might pull heavy loads on carts, or they sell small wares on the roadside. I mean, this is the type of work, and they barely have enough to go a few days at the most, if they didn't go to work. And so within 3 or 4 days, the whole slum community went into economic shock. There was no money. There was nothing to eat in the house. All the containers began to get empty. The cash in the pocket completely ran out. It went dry. And people were talking about masks and sanitizers. And mask, what's a mask? They never heard of this word in their lives. What's a sanitizer? It was all so new. They were scared. They were anxious. They were so worried. They didn't know what on earth was going on. And of course, we had to shut down our ASHA centers because of there was no public transport. Government instructions were very clear. And so when we ourselves recovered from this shock, we said, well, now we have to act. We must do something immediately. So what we did is that we started contacting all the college students in the various ASHA communities. And we are looking after 700,000 slum dwellers in Delhi, which is, I suppose, the size of a city in the US maybe. And and we're working in 91 slums. So that's a lot of slums and a lot of people. And so we started contacting all the young people who were in university, or maybe who had already graduated, but who were at home. And we said, listen, we can't come into the community, but can you become our Corona warriors? And can you volunteer to come forward and help? And we were just so amazed at the response from every slum. The young people started coming out. Yes, of course I'm going to volunteer. Yes, of course I'm going to volunteer. And it was boys and girls together. And they volunteered, they wore their ASHA t-shirts as you saw on the screen, and they went from house to house explaining what is the meaning of the virus, what's the meaning of how you cover your face, and how you're supposed to wash your hands. And people in slums don't wash their hands such a lot. For them, that itself was a big shock, that they had to wash their hands so often and wash them for 20 entire seconds. It was all so new to them. And so the people the ASHA warriors were just absolutely amazing. They were so full of courage. They were fearless. They were not at all scared of going into the communities. They understood that it's a problem that can turn very serious for people who are older, but younger people are relatively not so badly affected. And that information was enough for them to go. And what happened was that when they went, they came back with a report, daily report. Man, there's no money. And so what we started doing is straight away, our vehicles got into action. We opened up our headquarters. In 3 days' time, our headquarters was up and running. And the team somehow managed to come through vehicles that ASHA sent all over to their homes to somehow get them there, to arrange the logistics for 700,000 people in so many communities. And so what we started doing is, the first thing we did is send money. That's what they desperately needed. So we started sending money to the different slums, and our warriors went from house to house, and they prioritized those who were really needy. They prioritized the widows and the disabled and the young women who were pregnant with little kids, or families that had fallen into desperate and deep poverty. And so that's what we first did. And then, of course, the next thing to do was to give them food, because they hadn't cooked. And so when our warriors would come back and tell me that, ma'am, there has been no food cooked in their house for the past 4 days. And so we couldn't even procure the material. It was so difficult because the supply chain had gone completely broken. And so to be able to procure hundreds and hundreds of kilos of grocery items to be sent all over the city was a mammoth task. But I really do have to say that the entire ASHA family did not shy away from this, and we were able to somehow procure items. And so we made these grocery bags that had in them rice and atta, which is wheat flour, which is a staple in India. And we had 2 kinds of lentils, and we had oil, and we had the Indian, a few Indian curry powder spices. We had salt, which, they had no salt at home, and then a cake of soap. And these were the kind of essentials that we were able to put together. And when the grocery bag, I can never forget when the warriors called me, that evening, and, when the very first lot of grocery bags reached, they were telling me that they said they couldn't believe, the people who couldn't believe that there was actually a grocery bag being delivered to their doorstep, and so many of them became really emotional, and they started crying. And there were kids who were also looking at the food, and there were parents who were saying, our child hasn't eaten for so long, we haven't cooked for 4 days. And so we started crazily going around giving these groceries to the whole city, our vehicles going from here to there, and we had to get all these special permissions and things because we were not allowed to go on the road unless we were essential services. This whole thing went on for a month. It was after a whole month that the Delhi government decided that they were going to make food distribution centers all over the city for the poor. And so they were dependent entirely on ASHA for an entire month. Now, when the food distribution started, we thought maybe there'll be some easing. People will be able to go to the different food distribution centers, and they'll be able to get food at least twice a day. They'll get a proper meal from the government. But the moment the food distribution started, it was crazy, because the moment the truck would arrive, the disabled and the elderly and the women with kids and the pregnant women and the widows and the desperate, all would rush to the food truck with one little bowl in their hand just to get a bowl of rice and lentils, all falling over each other and somehow trying to get to that place where the food was being distributed. And the food was also being distributed so carelessly like this, and it was falling everywhere and falling on the ground. And, it was such a pathetic sight. And so many of them wouldn't even make it to the food distribution area because they just couldn't. Some of them couldn't walk, or they just couldn't handle those huge crowds. And so we were facing massive problem with the food distribution in the city. And so we continued with our efforts at giving out our grocery kits the way I described earlier. The ration shops, which we call in India, ration shops are like these government shops where they will give you rice and wheat at cheap rates. And so the ration shops started giving rice and wheat to the poor who had ration cards. And then they said, well, for those who don't have these cards, please go online and get an e-coupon. And we're going like, how can a slum person who doesn't know the first thing about the internet, or who cannot even dream of having internet, going to register and get an e-coupon and get ration from the government? Is that going to be possible? That's like a non-starter. And so that became another huge, big problem. And by the time it was end of April, because this whole thing began on March 24th. So by the time it was end of April, it started getting very hot. It became anywhere between 110 to 115 degrees Fahrenheit. And the heat, it was impossible for the slum dwellers to sit in their homes. You know, the warriors really tried hard, but it was a practical problem. They really had very little room in their homes. They were sitting outside, they were sitting on a little cot, or sometimes the young people couldn't handle it at all, so they would gather in groups. And our warriors really worked hard at saying, please, please, please don't collect anywhere. It's just a short while, but stay away from each other. And they must have, every day they would, after they would talk to me, they would say we were exhausted just by going on telling them such a lot, you know, that this is how they must live, otherwise they're going to be in deep trouble. And we also told them that if you do not adhere, and if you get a case, if you become sick with the virus, you are going to be at the mercy of public hospitals, and the infrastructure is terrible. When the whole thing started, the infrastructure was so bad, there was no beds for corona patients. Now, of course, you may have heard that the city has got unlocked a little bit, and since people have started coming out, the number of cases has risen dramatically. So as of now in Delhi, we get around 3,000 to 4,000 cases every day. And we've had about approximately 75,000 cases in Delhi, of which 2,500 patients have lost their lives. And of course, the total India number in India stands at 520,000. But we had about 40 or 50 deaths happening back then. But now, because of the crowds in the markets and lots of people who don't observe social distancing, the numbers have gone up. So what's happened now is actually the situation has become even worse, because those people who are in the slums, their jobs have not opened up. Those, for example, who are working in people's homes, the middle classes or those who are wealthy, nobody wants them in their house because they feel that they are living in the slum. They'll definitely bring the virus and come home. So there's no one's allowing them to work. All the factories are completely shut. All the scrapyards are completely shut. All those who used to get work by piece, or like, you know, if people would come and give them work at home, all that's completely stopped. There's no sign of it opening. So on one hand, you have the financial shock and the economic shock continuing. And on the other hand, you have a situation where there are a number of cases is going on increasing. And for a poor person, if they get this illness, the only place they'll be able to go to is a public hospital. And the situation of public hospitals is appalling at the moment. Patients are lying on, so many patients on every bed. There are patients lying on the floor. There are patients, dead bodies and live patients together. There have been so many videos that have been circulating and getting viral on the state of affairs in the public hospitals. And because of that, now the central government had to come in along with the state government to see what we can do to contain Delhi. But it's actually, of all the cities in India, Mumbai is number 1 and Delhi is number 2. But Mumbai is getting better in terms of the daily cases, and Delhi is at the moment the worst city. So you can just about imagine what's going on in the slums. You know, there's so much anxiety, so much fear, so much worry about the next meal, so much worry about their jobs. Are we going to ever be able to go back to those jobs, or will we never get those jobs again? And of course, there was a phenomenon you may have heard of thousands of migrant laborers going back to their villages. These were all people who either lived in a slum or who lived in some sort of unauthorized accommodation, which was very poor in nature. And so a lot of them have headed back to their villages because they feel that at least over there they'll be able to get something from their land, or they'll be able to be looked after by the extended family, or just the safety and security of having your extended family around you. So by the hundreds of thousands, a lot of people migrated. But I'm just glad to tell you that, you know, although, of course, you know, we decided that we can never abandon our Asha people, no matter what happens in this world. we have been friends with them for 30 years. This is not the time to abandon them. We are going to stand with them no matter what happens till the very end. And so there were many cases in which people did not go to their villages because they said, no, Asha families here, we can trust them, we can they'll take care of us, they'll see us through this terrible crisis. Let's not go traveling 1,000 kilometers, walking along railway tracks and walking along the highway to somehow reach our villages. We have Asha here and they do really care for us. So we will trust the fact that they'll be with us and they will not abandon us. They needed a lot of emotional support because of so many fears in their minds. And then I opened up the Asha centers after some time. I said, it's the time to open up the Asha centers. There was no place for the warriors. Where are they going to sit in 115 degrees Fahrenheit? They couldn't even have a place to sit or drink a bottle of water. So I said, we can't come there because we don't have the means to come, but you can run the center. And then our community health volunteers, oh my goodness, so many of the younger community health volunteers, ma'am, I want to help, I want to work, what can I do? I said, what you can do is help the non-COVID patients. There are so many non-COVID patients. There are patients who are having fever, there are pregnant women, there are patients who have got diabetes, patients who have got hypertension, there are patients who are little children who are getting diarrheal illness because of the bad weather. There's a host of diseases out there. If you want to help, then go out and stand far away from them. You don't have to go close, but you can treat them, give them. So we started sending them medicines for all common ailments so that they could make sure that a sick child wouldn't be just lying there. And there was a situation when there was like for example, there was a case of epilepsy and that boy was only 16 years old and he had fits and they kept on ringing up the local police. They dialed the number 100 and nobody came because in those days, at that time, there was absolutely no availability of the vans. And so that poor boy, 16-year-old boy, he just died right there in front of his family and nothing could be done. So there were so many different aspects to this and maybe some of this can come out in our Q&A if you want to know more. Like there's a lot that happened with malnourished children. There's a lot of things that we did to try and cope with that. And so we're trying to do the best we can. We are deeply mired in the midst of this crisis, which has turned even more serious since the time it began because there are so many more cases. People are so much more scared than they used to be. Back then, they didn't even know what this was. Now everybody knows what it is and they're so afraid. And there are so many people who might be able to go out but are not going out now because they feel that everywhere there are cases, everywhere there are cases. So the situation in our Delhi slums is really one of the most difficult and pathetic situations I've seen in my entire life. And whatever I've been able to do so far, right from March 24th has only been because of the support of Asha friends all around the world, which I can never forget. And so I just want to end by saying that the word Asha itself means hope, right? I mean, I believe that hope is stronger than fear. I believe that hope brings light to the darkest of places. I believe that hope can give us peace and strength. And I believe that as long as there is life, there is hope. So thank you so much for attending this webinar and I look forward to answering your questions. Thank you.
Mohan, you're muted.
Okay. So I'm requesting the audience to keep posting questions. I got a couple of these in here. So Kiranji, what sort of medical care is available in the slums?
So basically, through the Asha communities, centers that we have, the community centers, we are able to provide healthcare to all the non-COVID patients that fall under the category of primary care. So, but the COVID patients or anyone suspected of COVID, we have to immediately send them to a COVID hospital. And of course, if a patient does is COVID positive, then the government comes in and they take them away, they take their family away, and they also put up a poster outside the house. And there's nobody in the community that goes anywhere close. So apart from the fact that, we can't obviously treat COVID because we don't have that facility, but everything else which is not of a serious nature, which falls under the ambit of primary care, my team and I are doing our hardest best to try and attend to those patients.
Thank you. Another question we have here is, what's the current situation there, and how are you coordinating any help that perhaps the government or the NGOs are providing to the slums?
So, basically, during this whole period of lockdown, everybody disappeared. And that's understandable because it was a very frightening time. So there were no NGOs around. There was no government official around. There was no MLA, which is our member of the Legislative Assembly, which is our locally elected politicians around. Even now they aren't. There are no municipal councillors around. They were all scared and they all went and locked themselves in their homes. The only people, and this is, I'm telling you in all honesty, this was the only people whom you could see in every lane, in every street, in every community where we are working was the ASHA warriors and the police. The police were there because they had to make sure that the people didn't leave. So they would be patrolling the streets and the main lanes. And then once ASHA started working with the police said, you can do the work of patrolling inside and we'll take care of the work of patrolling outside. So those were the only two categories of people that presented themselves during this time of crisis. And even now, there is no one there except for these two categories. There's another third category that we have sort of put pressure on to come, and that is the sanitary workers, because we found that the public toilet blocks are all becoming filthy, and because the sanitary workers were too scared to come and clean up the toilets. And so there was garbage everywhere because no one was picking up the garbage. So we put pressure to ensure that because COVID is so directly related to sanitation, we said you must come and clean the slum. So we have those sanitary workers, and every time somebody becomes COVID positive, they come in and they sanitize the lane. So those are the people, but you will not see NGOs, you will not see, politicians or government officials in the slums.
Okay, thank you for that answer. We have another question. There are a couple of questions around the immediate needs. So what do you estimate the magnitude of need is in terms of funding food and medical care in the slums in Delhi?
Yeah, so basically, we are working among 700,000 and we are reaching out to every single one of the 91 slums that ASHA is active in. Every single day, we are providing groceries, we are providing child nutrition kits, which are special kits for the young children who otherwise they've fallen into severe malnutrition because they've not had enough to eat for so many days. So we've been paying special attention to the children. And then of course the PPE, now of course we have to provide face shields and masks and sanitizer and gloves, and the hundreds of warriors who are out every day and our team members every day, we need to replenish and they have to use this PPE on a daily basis for their protection, and we are completely committed to that. Then we also need funding for medicines because there are so many non-COVID cases and they have no money. So there's no question of them being able to buy medicines from anywhere, and they need cash very badly because sometimes they don't have money even to fill up a gas cylinder. So if you have a gas cylinder and there's no gas in it, what will you do with your grocery kit? You need the money for the gas. In the same way, they don't even have money for milk to make their children a little bit of tea. There are so many people say we are dying to have a cup of tea. So these are the different areas of focus where we desperately need funds. And at this point in time, the funds are coming and they're going. They're coming and they're going. And there are many areas where we've not been able to provide the groceries and the nutrition kits and medicines and money because we need resources. I mean, 700,000 is a huge population. There's so many slums, there's so many families, and they just need everywhere. So at this point in time, I don't think we've ever been so badly in need of funds as we are today.
Yeah. Thank you. We have another question here. uh, from the audience. Okay, so they said they saw lots of videos of local gurdwaras um, helping and providing food. Is that
Yes,
any help
yes.
to slums?
Yeah. So basically what happens is that I really admire and appreciate the work of Gurdwaras. They've done a great job. The thing is that their distribution centers are not inside the slums. So they distribute food in certain parts of the city. It can be outside the Gurdwara, or it can be, at another location that they may have found in order for that distribution to take place. So certain types of people might be able to benefit from that Gurdwara. I'm sure a lot of very needy people have benefited, because there are people who live on pavements. There are people who live in night shelters. There are people who live in unauthorized areas. There are people who live under the bridges of the city. So there is a lot of poverty in Delhi. So there are a lot of people who do have benefit and have really benefited and been blessed by the work of the Gurdwaras. But the thing is that in slum areas, the whole story is very different. It's right inside. You have to understand their condition. You have to understand their situation. You have to know, who are the widows, who are the disabled, who are the people who are really poor, who are the people you have to prioritize first of all. Otherwise, the people who are the strongest, the people who are the loudest, the people who are the ones who are most able to fight and reach the front will be able to get whatever they want. And the people who are the weakest and the people who are the most vulnerable and those who are right at the back are the ones who won't be able to reach anywhere. So because we work in those communities, because we've been working there for so long and we know the families very well, we are in a position to go right inside those lanes and streets and help them, each family, one family at a time, not leaving a single family behind. But I have to say to you that the Gurdwaras have done an excellent job.
I have a question, Kiran. Can we go back to what the question that you answered before the Gurudwara, which is, do you have a dollar amount of how much money? I mean, I know it could be an endless number, but what is a dollar amount that you would say right now, this absolutely would help us get through the next month or the next 2 months or 3 months or something like that, that would help all the people in the audience kind of, have a sense of what is the amount that could be used at this time for the work that you're doing?
So basically, as I said, it's endless because there are so many needs and there are so many families to cover. But I would say that, anywhere between $150,000 to $200,000 will get us through to maybe a couple of months or a month and a half. Where if we had more, we could do more, because the number of families is endless. And it's like, sometimes the emergency comes, we rush for groceries. Sometimes suddenly another emergency we feel, then we start giving money. Then there's another emergency, we feel that, there's a lot of problem with medicines in this particular area, we rush medicine. So like our vehicles are on the road the whole time, running from one slum to the other, reaching out as the need is. So this is like a very ballpark figure I've given you. And obviously if people are able to, because I do not see this thing coming to an end like right now. Maybe we can talk 2 months from now, but I don't know what will happen. Like, we know that our economy is not doing well at the moment. Everybody knows about this. And the poor have been the ones that are most affected simply because they have no savings. Then they have no safety net to fall back on. And so maybe we're talking 3 months, maybe we're talking 4 months, So if it's going to be longer, obviously we'll need more. But, that sort of like, even if we can say collect $200,000 or $250,000 for say 3 months or something, we can do a lot.
Thank you. We have another question here. Is the USAID helping in any way at this point?
You know what? We have USAID, we have the British Department of Development, we have the Australian Department of Development. We applied to all of them. We said, we desperately need money at this time. There's one Department of Development that came forward, and that was the Australian one. And we were very grateful for their help. They gave us 13 lakhs of rupees in 2 tranches. And the second tranche came only day before yesterday. They themselves said that we have some extra money, and because you need it so badly, we're going to ask you to apply, and then they gave us this money. But the other aid agencies, I don't know whether it may be because they have a certain priority in terms of states, or a lot of them work with governments. And I also know that a lot of the aid agencies, their staff have gone back to the home countries, and a lot of the embassies over here, the high commissions over here are running on a skeletal staff. So I don't know all the technicalities behind, what's going on, but I can just say that we have tried really hard to get money from embassies and high commissions just because we already have a relationship with them going back so many years. The US embassy also knows us very well. And the Australians have responded in the biggest measure, and then the New Zealanders have responded in a smaller measure.
Good. Thank you. Every little bit helps. Another question we have is, have some of the ASHA residents started going to work?
Yes, a few. Just only, you can say 2 weeks ago, they started. I would say 7 to 8% of the residents have started going. So like some of them would go and go take their rickshaws, to pull rickshaws, say in the old Delhi. But they come back because there's no one there. There's no one to sit in and for them to get a fare. Then the ones who pull heavy loads on carts, for example. Well, they went with their carts to the local markets, but all the shops are closed, and so there's no work, there's no load to pull. So then they came back. And then when it comes to, say you're selling small wares, somewhere on a footpath, that's completely prohibited. You can't do that. There were so many maids who went to phoned up their employers saying, can we come and start working again now? They said, no, we just cannot have you till this whole COVID thing completely dies down. So right now, I would say a very small percentage of the population has started going.
Another question we have is, what's been the situation with the schools and the school-age children? Are they shut down, or are they sending schoolwork home? What's happening there?
I'm glad you asked this question. There's a huge inequity between the children who live in slums and go to school and the children who are from middle class and well-off families and who go to school. Because schools are shut, they have been shut right from the day one of lockdown, and there is no plan of opening schools anywhere before end of July. That is what the government notifications say. They are giving school work to children, assuming that every child will have a laptop and every child will be able to do work online. But then that begins to, there's this huge divide out there where our slum children absolutely do not have smartphones and there's no way they can do work online. Now, when you come to the colleges, just, since we're talking of education, we've run into huge problems because what they've done is they've declared that the Delhi University final year exams are going to be held online. And that came as such a big shock to our students because, you and our children can sit in front of a laptop in their homes and they can practice taking online exams and they can get it right and they have scanners and they have everything and they can do this. But our slum children just use a tiny little smartphone at the most. So what we did is we said, now there's no way out. We wrote to the Delhi University. I actually sent a letter to the Vice Chancellor of the university saying that, there are hundreds of children, there are ASHA children, there are other children who are poor, who don't have all these facilities. So you should not be taking an online exam for everyone because it's not a level playing field. Anyway, that didn't go anywhere. I also believe there was a public interest litigation in the courts against this, but it's not gone anywhere. So what we've been doing is we've been calling all these final year students to our ASHA centers and teaching them how to actually use cam scanner on your phone, showing them how they can access the question paper on the phone, providing them with this A4 size sheets because stationery is expensive. They don't have the money at the moment to buy their stationery, providing them with all the A4 size sheets and in many cases giving them Wi-Fi wherever we can do whatever. Because in some places you have Wi-Fi, some places you don't have Wi-Fi, some places stable, some places unstable. So with all of that, we think that we have been able to prepare them enough by them taking lots and lots of mock exams so they understand how you even scan a paper and upload it and email it to your university. Even that was something, it was a big shock. How are we going to ever do this? So the exams are going to start in the first week of July. So they will be requiring your good wishes and blessings so that they do well. Because if they don't do well, then their future after that gets blocked. And they've not had any internships this year either because normally internships every summer, but this summer there'll be no internships. So our education, there's a lot of issues, a lot of problems with our school children as well as our university goers, and they really do need all the support that they can get.
So we have another question here. This is from the director of Rotary Club. This is Christina. Kiran, do you remember we met
Yes.
her last year?
Yes, I do remember.
She's thanking you for your work. She can't imagine how New Delhi would be without your work. And she wants to know if the Rotary Club of Delhi Southwest are doing anything to help Asha and support your work.
Well, I don't have any connection with them, and it may well be that they are not supporting us because we simply haven't met. That could be a reason, and it might well be that they're supporting someone else in another way, because I really don't know them. But if you wish to provide an introduction, and if you know them, I'll be more than happy to engage with them and see if we can create a partnership where we can then together be able to offer help.
We'll take that action item and circle back with Christina. Another question here. Have you any idea about the infection rate in the slums? And is there any testing being conducted for the virus?
So basically, that our testing in Delhi is in a big mess because the population is too huge, and there too many. The goalposts keep shifting all the time. One day there's one policy, another day there's another policy, then a third day there's another policy. So this shifting goalpost has created a huge amount of confusion, and there's multiplicity of authorities. The central government is also here, the state government is also here, and then there's a lot of politics. So our testing is in a big mess. And so at the moment, our hospital, the hospital beds, they claim that they have increased the number of hospital beds. But again, there's a shortage of staff, because you can go on increasing the number of beds to as many thousand, but then you need doctors and paramedics to be able to man the hospitals. So that's another big issue. And while they are thinking that they would like to test everyone, right now none of that is happening. They are basically anybody who's suspected of COVID, who goes to the hospital with breathlessness, is tested, and if the patient is COVID positive, then their whole family is tested. And then in the beginning, when we had started, it was not community spread, it was directly related to a traveler coming from another country. So at that time, they were looking for all the contacts of that particular person, whoever the person may have met, and they would test them. But right now, all that's gone, because it's now it's sort of micro community spread. You can't call it community spread in the sense that the whole country is just swimming in the virus. It's not like that, but it's micro community spread. So in various areas, you'll find that there are clusters of communities where the virus has spread more. So in those sorts of places, they call them containment zones. In some of these containment zones, they carry out more extensive testing. So they have the containment zone, they have the red zone, they have the yellow zone, and then they have the green zone. So in the green and yellow, there is no testing at all. In the red zone, only localized to where the patient is. And in the containment zone also, there is a little bit more testing, but actually every person in the containment zone should get tested, but that's not the case. And another phenomenon that everybody recognizes is that people are really scared of getting tested if they have mild COVID, because they feel that they're going to be taken away from their community and they're going to be put in some terrible facility where they won't be able to meet anybody. So what they typically, if they have fever and if they have a cough or something, they simply just stay at home and they don't volunteer to get tested.
We have another question here. Have you guys approached the pharma companies for donation of meds?
As of now, the pharma companies were all closed, because of the lockdown. There was nobody. In fact, even for the, Bhagirath place is the big, wholesale market for drugs. That's where in Old Delhi,
Yeah, I know very well. I grew up there.
You know where it is. So that's where, all the shops are and the wholesalers are. And everything was closed up until last week. Now they have like every fifth shop is open or something. So there's no one in action. That's a problem. And even for the drugs that we want to buy, even when we're willing to pay money and buy, it's not been easy. We've had to really struggle. And our very long-standing old vendors whom we've been working with for so many years, we said you have to prioritize us because you've known us for so long and you've been getting a lot of business from us. We don't care, you have to get us PPE. We don't care, you have to get us this. So we somehow have been able to procure, through the old vendors that we have.
Okay. Let's see. I think I've gone through most of the questions in the chat. Let's see, there's one more message. No more questions. Guys, keep asking questions. We can go for a couple extra minutes here, since we had a little late start. We are 7 minutes past the hour.
I have one of my warriors here. If you want, he can come and give you a wave.
Yes, please.
Shiv? Aaja jaldi se. Come quickly. Mask niche kar. Come and stand next to me.
Yes.
This is Shiv.
Hi.
And he's one of the ASHA warriors.
Hi.
And
How are you?
he's one among 300 warriors. He's been going from house to house, home to home, giving money, identifying people, working with the police,
Yes.
giving out groceries, and he's not scared. He wears his face shield and he goes off every single day. And he represents all these wonderful warriors who've taken us through right from 24th March onwards.
You're
They did
looking
not
good.
leave them even one day.
Thank you so
Thank you.
much.
Thank you for your work.
Thank you so much, your love and your support.
Yes.
Thank you. So, in the closing, I would like to say our heartfelt thanks on behalf of our entire team that you've made the time on this weekend